cervical cancer, fortunately, is very slow growing. So it's something that takes, 10 to 15 years even at a time to develop. And so you look at your patients, you look at your women, and you wish you could have met them a couple years sooner at any point earlier in that decade, and you could have helped prevent them get to where they are. Cervical cancer is mostly treated with radiation. It's not a surgery. It's not really a quick fix, and it's a lot for anybody to go through. So radiation, if we're talking about putting radiation on the pelvis to destroy, the bad cells, it's also going to destroy some good cells. So it can hit the ovaries. It can put women into kind of an early menopause. If it's destroying the ovaries and their hormone function, it can really change, the tissue there, and that women's sexual function, things can really be affected for them. So it is treatable. It's definitely one of those cancers we've got good treatment for. But I hate to see it get to that point, especially in young women. The screening guidelines for pap smear start at age 21, and depending on how old you are, every 3 to 5 years. So the fact that getting the virus and the virus being there for multiple years, long enough to cause some sort of long-term infection and change to those cells in order to get a low-level precancer, a high-level precancer, and eventually a cancer, that takes time. And so that's why the guidelines are what they are. And actually they've been loosened a little bit over the last decade, because we know that doing a pap smear once every 3 years or once every 5 years is going to catch any abnormal cells. And we have interventions to get rid of those bad cells before they ever grow into something else. I know if I see them and your women are getting routine pap smears, that they're not going to be facing cervical cancer down the road. In the United States, as far as our gynecologic cancers of the uterus, ovary, or cervix, it's the least common. And it's because we're doing more education. We have vaccines available that are extremely effective. And we're doing routine cervical cancer screening. We're doing pap smears. It's available. It's something that's really offered at all primary care doctors, and especially gynecologists. Their pap smears are cheap. They're effective at catching the things that they need to. And we have all these resources readily available. So the United States has done a really good job making these resources available, helping women have access to them, to the point that cervical cancer has actually decreased by like 75% in the last 50 years. We know the things that we're doing are working. But the sad thing is, in countries with less resources and resource poor countries, we still see a lot of cervical cancer. It's actually one of the most common cancers for women to die from. So we see the difference, that offering the vaccine and providing routine screening, we know that it helps. Speaking mostly with pelvic exams, not a lot of technology has changed. I know women hear the dreaded word speculum, and that's, can entice a lot of fear or, being uncomfortable. But we have plastic and we have metal speculums. They're, well designed. There's lots of different sizes and shapes, and I think it's more about, kind of talking you through what we're doing, showing you what we're doing, having the patients be actively involved in their exam, and just feeling comfortable with what's going on. I think it's important for women to know that just because they had a pelvic exam, someone examined their pelvic area, it does not mean that they had a pap smear done. So sometimes there's some false security, thinking, a doctor or, a provider of some sort looked in that area, things must be fine, I must not have cervical cancer. But there's multiple components to that sort of exam and screenings, and sometimes it's just looking, sometimes it's using that speculum just to open part of the vagina to see the cervix at the top, or using 2 fingers for a bimanual exam to feel on the cervix and the uterus and the ovaries. That doesn't mean that we used a soft tip plastic brush to brush the edge of the cervix to actually test that for precancer or cancerous cells. So not a lot with actual pelvic exams have changed that much lately. Correct. So it's very important that women have annual, once a year, well woman exams. They're designed to be preventative. We are there to address any concerns that you have, but mostly say, maybe if things feel great, let's take a pause and talk about all the routine screening things that you can do to help make you and your family safer going forward for the next year. What are things that maybe we haven't talked about? Seatbelts, sunscreen, routine immunizations. Yes, things like immunizations mammograms and colonoscopies and those things. But a lot of times it just involves us kind of checking the pelvic area, feeling on the ovaries, giving the women, an opportunity to talk about abnormal bleeding or pain they may be having or issues with incontinence, things that we don't always go out of our way to schedule those types of appointments for. But well woman exams are kind of just that routine surface. We want to talk about everything. But most of the time we're not doing a pap smear. It's usually every 3 to 5 years. So unless you're at one of those milestone visits where we need to do the pap smear, we typically don't. But we should be pretty good about communicating, hey, you had your pap this year or you need it next year. But it is important to know kind of what you're having done, and then also to remember that if you have any not normal pap smears, you may not fall in that normal screening guidelines between 3 and 5 years. That it's important to have talked to your doctor about what your results were in case you need a pap smear or another procedure sooner than that normal interval. Before they have sex for the first time. So the vaccine right now is available for ages 11 to 45, but can be given as early as age 9. So this is a hard conversation for parents because we want to encourage children to be vaccinated before the onset of sexual activity, because the vaccine is going to prevent up to 9 strains, essentially, of high-risk strains of the human papillomavirus. If you don't get those high-risk strains of the virus, you're not going to get cervical cancer down the road. You get HPV from sex. And so if we're able to get to teens and adolescents before the onset of sexual activity, protect them from these high-risk strains of the virus, they're going to be protected going forward. It's still okay to get the vaccine after onset of sexual activity, all the way up to age 45, maybe later. Or even if you already have HPV, even if you've already struggled with having procedures done on your cervix to remove abnormal cells or precancer cells, you should still get the vaccine, because there are still other strains of the virus that if you were to get could still be causing problems for you. It's for men and for women. So all boys and girls in that pediatric group, pediatricians, should be talking to their parents, but I mean, it's for the children. Children should always get to be involved and aware of, their care and things that are being put in their bodies. But it's a hard conversation for parents because they feel like we're somehow giving the children, or teenagers, young adults, permission or encouragement to be sexually active, because to say, oh, well, here's this vaccine, now you're protected, go have sex. And that's not the message at all. It's regardless of decisions for sexual activity or amount of sexual partners or whether or not they're using condoms and other barrier protection, the vaccine is still going to help them, whether they choose to, if they get the vaccine at age 11 and they have their first onset of sexual activity at 32, that is still going to protect them then. And, we just didn't know when their exposure was going to be. So boys and girls by age 11. Because boys carry the HPV virus and they're mostly asymptomatic. They don't have symptoms. They don't have a cervix for us to test for the HPV virus. What happens during a pap smear is we test for the cells on the cervix to actually look at under the microscope to say, hey, this is normal, it's a little abnormal, or it's really abnormal. But we also test for the virus over the age of 30. We know that having the virus, especially over multiple years, is a risk factor for getting the cervical cancer. We don't have the ability to test like that in men. Men do get the HPV virus. That's dangerous that they don't know they have it. Any sexual partner that they're with is essentially exposed. Men, if they're symptomatic, will have warts, is typically what we see. So there may be a wart somewhere in the penile or scrotal area or the anal region, but they otherwise don't have a cervix for us to test. So that's how women are getting HPV, is from their sexual partners, which if men have it, they're transmitting it. There's over 200 strains, mostly there's about 40 that affect kind of the vaginal genital area. I describe HPV kind of like the flu. There's lots of different strains. You never know which one you're going to get. You may kind of get the sinus sore throat one. You may get the GI upset. You don't really know how you're going to feel, how you got it, how you're giving it to people. I essentially think of HPV the same way. There's lots of different strains. You don't know which one you're going to get. You don't know how many you have, essentially. But we test for the high-risk strains at about 80% of HPV, or of HPV high-risk strains, or ones that are causing cervical cancer, are from 2 different strains. And we test for those over the age of 30 with every pap smear, essentially. So if you don't have the virus showing up in your system, we don't feel like you're at risk, really, for cervical cancer. And especially you can go those 5 years, you can go 5 years in between before you do another pap smear, or test again for the HPV virus. Once you have the virus, it is for life. It's like any other virus, HIV, herpes, hepatitis. Once you have most of those viruses, they're for life. But your body does a really great job, depending on your age and other things going on with your immune system, of really fighting that virus, beating it down, keeping it low and inactive. So from the first time you are exposed to the virus or test positive for the virus, maybe later in your life you may test negative. So especially young bodies, younger women, do a really good job of clearing the virus on their own and making it kind of an inactive status to the point that it's not going to cause precancer or cancer. That's why, regardless of onset of sexual activity, we don't start screening till age 21, because in those teenage years, you may have the virus, but we're really not worried about it doing much damage at that point. That's why the average age is 50 to get those cervical cancers. The older we get, the less strong our immune systems are. And at certain times in our life, whether we're going through a lot of stress, or pregnancy, or we have other autoimmune diseases that are really working our immune systems to fight other things, it may not have as much reserve to fight things like the HPV virus. And you may see it become more active during those times. It's only going to cause problems when it's active. So we test for whether you have it in general, and once you already have it, we test for it being active in the future, as well as any abnormal cells that could progress down the road. They're definitely going to help. It's about any sort of skin-to-skin contact, and because you can get the cancer for men, obviously, really anywhere in the genital region, and for women and men, you can have the warts other places on the outside or more on the vaginal area, or really it's more about dealing with the cervical cancers internally on the inside parts. But any skin-to-skin contact has the ability to transmit the virus, but condoms will go a really long way at helping preventing the virus. And not smoking. Smoking cigarettes increases your chance by about 50%. You do, because there's those 200 strains, or 40 really in that area, that we're concerned about. So we're helping. Some of the older vaccines only did a couple of the strains, then we went to 4 strains, now we're on to 9 strains. But you may not know what strain or how many strains you're protected against. It's not 100%. And just because we're mostly protecting against the high-risk strains that are going to cause cancer, you could still get another one, or you could get one that causes warts, which can also be pretty bothersome. I know that I'm in this field, and I can speak for most of my colleagues, that we're in this field because we want to advocate for women. But I think mostly we want to help women advocate for themselves. We want them to be in charge of their health and feel good about what they're doing or not doing, and what they're going through, and what peace of mind that has for them. And it really is impactful to have that meeting once a year, at least once every 3 years, with us, and let us help you get through the exam. I can do it a couple seconds. Like, we can get this pap smear in just a few seconds, and I promise you we'll help you do it. If you just show up, and we'll help you get that pap smear, and you've got to feel good about yourself and the things that you're doing for you and your family at that point. Mm-hmm. Yep. Couple seconds.
Has it always been that way?
Yeah. I mean, everybody has slightly different techniques, but if you give me 1 minute, I can help you through this pelvic exam, and we can get a really quick pap smear. Certain things can make it take longer. If we need to take a break or we need to talk through the steps, I will show you the instrument we're using. You can hold it, you can touch it. We can talk about, what we're doing. You can have support people there with you. Whatever you need will help you get through the exam, but it's not a big hour event. It's really not.